Can we do it?
Welcome back, everyone, to In Between Sessions, Beyond the Walls of the Therapy Office. I'm your host, Samantha Hill, and I'm so glad that you're listening today. Our goal with this show is to break down mental health topics in a way that's approachable, relatable, and informative. Whether you're navigating your own journey, supporting someone you care about, or you're just curious about how our minds work, we want to create a space where open discussion about mental health can be made while breaking stigmas. This episode, we're going to be talking about mental health in the Black community, as well as a little bit of information about Black History Month. We also have our counselor here, Cedric Turner-Kopa, who's going to be giving more information and insight about mental health within the Black community as well. So first, let's break down a little bit of the history behind Black History Month to give some context and foundation of why we celebrate this month and the importance of celebrating this month. When we talk about Black History Month, its roots actually trace back to Chicago in the summer of 1915. That year, historian Carter G. Woodson traveled to Washington, D.C. to take part in a national celebration marking the 50th anniversary of emancipation. The event was sponsored by the state of Illinois, and it drew out thousands of African Americans from across the country. These people gathered to see exhibits that highlighted the progress of their ancestors and what they have made since the end of slavery. Just 3 years earlier, Woodson had earned his doctorate degree from Harvard University, and at the celebration, he joined other exhibitors in presenting Black history display. Even though the event was held in the Coliseum, best known for the site of the 1912 Republican Convention, the turnout was so massive that between 6,000 to 12,000 people waited outside just for a chance to see the exhibits. That overwhelming response left a lasting impression to Woodson. Inspired by the 3-week celebration, he decided to form an organization dedicated to the scientific study of Black life and history before leaving Washington. As the organization grew and its impacts expanded, Woodson eventually announced a special week and honored both past and present contributions to the Black community. That week laid the foundation for what we now recognize today as Black History Month. So now we have a little bit of understanding of what Black History Month is. Let's talk about the mental health within the Black community. Mental health within Black community is far more than skin color. It's shaped by social norms, culture values, traditions, and lived experiences. We all know that people of all races and cultures experience mental health conditions, and Black individuals experience them at rates similar to other groups. However, when we take a closer look, historical and cultural factors have created deep disparities in access to care and treatment outcome. For example, about 25% of Black adults seek mental health treatment when it's needed, compared to the roughly 40% of white adults. Mental health refers to our psychological, cognitive, and emotional well-being. It's influenced by social identities such as race, ethnicity, religion, social class. Importantly, the mental health challenges faced by Black individuals are not caused by Black identity itself, but the systematic issues that have existed for generations. One major contributor of ongoing disparities is unequal access to health care. Nearly 10% of Black adults in the U.S. are uninsured, compared to the 5.2% of non-Hispanic white individuals. According to the U.S. Department of Health and Human Services Office of Minority Health, Black adults are more likely than white adults to report persistent emotional distress, such as ongoing sadness or feeling like everything takes an enormous effort. Black adults living below the poverty line are more than twice as likely to report serious psychological distress compared to those with greater financial stability. Despite the need for care, only 1 in 3 Black adults with mental illness receive treatment. According to the American Psychiatric Association, Black individuals are less likely to receive guideline-consistent care, less likely to be included in research studies, and more likely to rely on emergency rooms or primary care providers rather than mental health specialists. The Black community accounts for nearly 20% of people living with depression in the United States, yet they're significantly less likely to receive treatment. Black adults are also exposed to more risk factors for anxiety, such as racism and discrimination, than their white counterparts. Additionally, Black adults living with mental illness are a higher risk for substance use involving alcohol, nicotine, marijuana, and pain relievers. The statistics have become more alarming for the youth. Black children from ages 5 to 12 are twice as likely to die by suicide compared to white children. Among Black and African American young adults ages 18 to 25, suicidal thoughts, plans, and attempts have been rising steadily since 2018. In 2024, Black and African American adults were reported to be 11% less likely in the U.S. overall to report having a mental illness in the past year. That same year, there were 36% less likely to receive mental health treatment. So now that we've developed a bit of a foundation of what Black History Month is and some Now that we've developed a bit of a foundation of what Black History Month is, as well as some statistics that fall into mental health within the Black community, now we're going to be looking at more stigmas that are around mental health within the Black community and explaining and elaborating on this. Cedric Turner-Kopa, he does a really great job explaining this and giving more details. But first, stigma around mental health is not new in the Black community. Even Dr. Martin Luther King Jr. reportedly struggled with severe depression during different episodes of his life and refused psychiatric treatment despite the encouragement from his staff. Unfortunately, this pattern still exists today, and many African Americans avoid mental health care because of stigma. The roots of mental health stigma in the Black community can be traced back to slavery. During that time, it was widely believed that enslaved people were not intellectually or emotionally capable of expressing depression, anxiety, and other mental health conditions. According to Crawford, additional barriers to care included a lack of cultural sensitivity among healthcare providers, feelings of marginalization, and heavy reliance on family, community, and spiritual support rather than medical or psychiatric treatment. Even when professional care is critically needed, Black Americans develop health conditions at rates similar to anyone else. However, the Center of Disease Control and Prevention has declared racism a serious public health threat that places communities of color at increased risk for poor health outcomes. Beginning in the 1600s in the United States, Black people were subjected to systemic oppression through enslavement and later discriminatory laws that persisted through 1965. These policies legalized harm and exclusion, leaving generational scars that still affect mental health today. According to the American Psychological Association, racial trauma can result from direct exposure of racism, as well as more subtle, repeated experiences that accumulate over time. Direct experiences may include physical or verbal attacks, while indirect stressors can include exposure to videos of police brutality on social media or being subjected to consistent put-downs. Racial trauma can also be intergenerational, passed down from one generation to the next through shared experiences and survival responses. Exposure to trauma is higher among Black Americans than any other racial group. Due to socioeconomic disparities, Black individuals are more likely to experience traumatic events such as racism, discrimination, poverty, police brutality, and community violence. One common stressor is code switching, the act of adjusting one's identity or behavior to blend in with a dominant group. Code switching can happen in many settings for many reasons. These identity shifts may cause to be drawn attention away from the aspects of race, ethnicity, religion, socioeconomic status, education level, sexual orientation, or ability. Other stressors include microaggressions, which are subtle but harmful comments or behaviors that reinforce stereotypes. Avoiding stereotypes is another constant pressure. Harmful stereotypes strip Black individuals of their individuality and can create anxiety about how they're perceived or judged. There are also fears of systems, including educational, legal, and healthcare systems that have historically overlooked or mistreated Black people. Additional stressors include internalized racism, intersecting identities, self-doubt, and adultification, where Black children are treated as older or more mature than they actually are. Negative attitudes and beliefs toward people living with mental health conditions remain widespread in the U.S. and are often especially strong within the Black community. While perspectives vary, research shows that many Black adults, particularly older adults, view mental illness as a sign of personal weakness. As a result, individuals may experience shame, fear judgment, or worry about discrimination if they acknowledge mental health struggles or seek treatment. Today, I'm joined by Cedric Turner-Kopa, a licensed psychological associate and a licensed clinical addictions specialist, who's going to speak more about the mental health stigmas surrounding those within the Black community. Hi, Cedric. How are you today?
I'm well. How about you?
Good. Tell me a little bit about yourself.
Yeah. So I'm from the Goldsboro area of North Carolina. I went to school for my undergraduate at UNC Pembroke. I graduated with a bachelor's in psychology, and I liked it so much I decided to continue to go to school for clinical psychology at UNC Wilmington. My program at Wilmington was specialized in treating adults with mental illness and also substance use and abuse disorders. Back in the day, we used to call it co-occurring. Now it's called
Co-occurring?
Co-occurring disorder. No, back up. Back in the day, it was called dual diagnosis.
Dual diagnosis.
Yes, meaning that there's a substance abuse problem and also a mental illness. Now we call that co-occurring.
Co-occurring.
Yes.
So is there any difference between substance abuse, like someone who specifically goes to study school in substance abuse? Like, is there difference there, or is yours more like a interdisciplinary study?
So back in the day, there was big, I don't know, therapeutic, or there's big, how do I say this? The minds were at battle with each other. There were big theories at war in regards to how you treat an individual that had a mental illness or substance abuse, where it's like, all right, we have to treat the substance use and abuse first before we do the mental illness, or the mental illness has to be treated first before substance abuse could take place.
Gotcha.
So in regards to doing both, we treated the whole person. That's what I learned how to do.
So you're like doing a co-occurring.
Yeah.
Back to that term again.
Yeah,
wow.
right. That co-occurring.
I
Yes.
accidentally used it. Didn't mean to.
Yeah, right there. It happens at the same time. So treating the person as they come in all at once.
Gotcha.
Right?
Gotcha.
And it helped understand that individuals could have more than one issue going on at the same time.
I like that. That's a great approach. I like that.
So yeah, I also grew up. I was born a black person, foundational Black American. My mom is from a small town in North Carolina. My dad's from Georgia. And I'm descendants of slaves. At least that's what I learned when I did my ancestry DNA.
Wow.
And I got really connected to Black consciousness when I was in college. I joined a historically African American fraternity and learned a lot about Black history and Black thought. And
did you do that undergraduate level?
that was my undergraduate at UNC Pembroke.
Okay.
So after Pembroke, went to UNC Wilmington and studied psychology, clinical psychology. And then after that, worked in the field since 2010 with some breaks. So it's been a little more than a decade I've been working in the field.
Wow.
Yes.
So what is like your main focus when it comes to, or like your main specialty when it comes to mental health?
So my main specialty is working with individuals with substance use and abuse. And what usually comes with that, at least my experience, has been there's trauma that an individual also has coming up and that they've experienced in the past.
Gotcha. So you do normal counseling for your common mental illnesses, substance use, and trauma?
So yeah, when you say normal counseling, yes, anxiety, depression,
Yes.
Individual just needing to talk, and also working with substance use and abuse.
So you're a 3-in-1.
3-in-1, sure.
That's crazy to
Sure.
think about. Hey, we need a lot of multi-interdisciplinary careers, and especially in this world where there's so much happening going on at one time, it's important that we have like someone who can be specialized in multiple things at one time. So today I have you in. We're going to talk about more about the mental health in the Black community, breaking down some stigmas and some common misconceptions that come along with it. But also we're going to be talking more about race-based trauma and culturally competent care. So first, break down some of the stigmas that surround the Black community when it comes to mental health, and like how do they manifest and what does it look like?
Yeah, first, when you talk about stigmas, there's first a big distrust, not just with mental health, but health in general, within the Black community. And we can look at this historically. Are you familiar with the Tuskegee studies that happened in Alabama?
Alabama, I think so.
So between in the 1930s to 1970s, Alabama actively infected Black men with syphilis and sent them out in the community just to see what the result was going to be on that.
Wow.
And so with knowledge of things like that's a really big example of how the medical community traumatized Black Americans, right? Up until 1970. And I'll give you for example for myself. I went to the doctor and I found that I had a low white blood cell count, right? And then my doctor sent me to a hematologist and an oncologist, right, to see if I had blood cancer. And they did the test, and what they found is that, well, no, Cedric, you don't have any blood cancer. There's nothing wrong with your blood. It's just that black men at times have low white blood cell count. And they were comparing my blood to, I guess, the normative sample, right? I'm using air quotes.
Man.
Yeah.
Okay.
And I was like, what? I was stressed out. Like, hold on, what do I have? What's going on with me? But it was actually that if you compare my blood to other black men's blood, I was in the normative range.
That's interesting.
So yeah, that felt like the medical community got me wrong. They didn't see where I was. So going back to the question about stigma in the black community in regards to mental health. At times, individuals have felt like they haven't been seen, right? Or they've been dismissed, or their pain is not being recognized, right? It doesn't help when individuals have had not been made. Their promises that have been made to them haven't followed through, right?
Gotcha.
Also, bureaucracy is another reason why individuals have just not wanting to get caught up in that. What else? Oh, the microaggressions that occur within mental health or outside of it, and lead an individual not wanting to go to it, and within the community too. In the black community, there's been this idea of being strong, right? Being strong. You're a strong black woman. You're a strong black man, right? And going to therapy is admitting that you're vulnerable, and being vulnerable is not a part of what the black community strives to be, right? There's another part about snitching. Right? Snitching, yes.
That's a
or we might say family business, right? This is family. This is family business, meaning, hey, this is private. This is secret for us. This is we handle this. An example is I've had some cousins that had severe mental retardation, where they could have went out and got treatment. It was like, no, we don't want to get other people, white people, right, the government into our family business, right? We can take care of our child or this child ourselves, right? So there's a reluctance in the black community to give up that power of their secrets because of fear that they're going to be mistreated.
Yeah.
Or there's not much trust at times with that.
How do you think that the trust has been rebuilt over the time?
How do I think that the trust has been rebuilt over time? So there's been a change in zeitgeist, right? There's a change in the zeitgeist of getting mental health and mental health not being just a white thing, right? There's been prominent celebrities that have came out and said that they're utilizing mental health for themselves, and showing within that idea that I told you about being strong, being a strong black woman or strong black man, there is strength in being vulnerable, right? And there's growth in that. And we're also recognizing that there is this such thing called racial trauma that we're carrying, that we try to mask with substance use or this other ineffective coping strategies in the community that we want to try to violence, right? We want to try to break ourselves of, and that's helped change tremendously, where we found that even if you're you can still be a whole person, whole adult, and receive mental health treatment, right?
Gotcha. Let's dive a little bit more into that racial trauma.
Sure.
Explain what that is, and maybe explain it to someone who may not know what racial trauma is, and maybe a few examples that go along with it.
Yeah. So racial trauma is when somebody feels emotionally or mentally injured by an encounter based off racial bias or racial crimes that occur. This could be direct, It could be something that they've experienced, like vicarious. It's very similar to PTSD, and it manifests itself with feelings of hypervigilance, meaning that you're on edge, keyed up, depression, anxiety, right? Issues with your vegetative symptoms, sleeping, eating, right? Being on high alert again. And this might occur when you have instances where individuals die because they are black. I'm thinking of Eric Garner, right? I'm thinking of the several, even going back into history of like Emmett Till. When I learned about Emmett Till, like what this black boy was killed because he was being a boy and whistled at another woman that was a different race. Oh, that could have been me, right? That could have been somebody in my family. And so experiencing that and realizing that you are close to, I don't want to say being victimized, but close to an individual that's had tragedy happen to them could affect an individual.
Would you classify that as like a generational trauma where it kind of is like gets passed down? Like, how would you classify that type of like for a group of people or for a family, for example, who may be victims of this, like something happened to a family member? Like, is generational trauma relevant for people part of the black community?
Yeah, absolutely. We call it intergenerational trauma, right?
Intergenerational trauma.
It goes from generation to generation, right?
Okay.
To where intergenerationally, like my family says, hey, you don't trust the police. We're law-abiding citizens. A lot of us have never been arrested, right? But intergenerationally, we've learned that through interactions with police, you could get hurt or killed, all right, because you are black.
And that goes on top of stereotypes.
Yeah,
and,
absolutely.
Internalized racism.
So internalized racism is a little different.
Okay.
Internalized racism is I'm taking in what individuals think about me inside, right?
That's like a internal thing, like you.
It comes from outside. So if I'm seen as a criminal, right, I internalize that like, well, I am a criminal. I am worth nothing, right? That's the internalized racism. And it's complex, Sam, because this could be passed down from generation to generation. Like, you're a criminal. You're nothing just like the rest of us, right?
Gotcha.
So, yeah, that internalized racism is...
Gotcha. So what are some of the approaches that an individual can take that may be feeling as if they are alienated, or that they feel like their mental health or their physical health too is not taken into priority? Like, what can an individual do to help make sure that they get the proper resources and tools that they need to help better themselves? Because I know sometimes the first step and the hardest step is to admitting that, something's wrong, I need help. So what are some ways that, members of the black community can make those first steps? Yeah,
community is key. Like working towards finding individuals, kinfolk, skinfolk, right? Whatever folks that are around you that could help you be seen, right? Helps, especially when we're talking about the black community. One of the issues, I know you didn't ask this, but I'll say it anyways. One of the issues that we see at times is that black community finds that their people, their community, like in their church, right? But at times the church says, we could pray this away, and I've seen great things with spirituality and with the resources that happen that are provided by churches, but sometimes individuals need more support than the church, and so what's important is one, recognizing that they need the help, right? Being vulnerable, being honest with themselves enough to say, hey, this is tough. Seek out community, right? I also recommend sometimes having a media diet, right? It hurts seeing black individuals criminalized, are being, it it hurts, and it's tough to see black faces and on in the media in a negative way.
Yeah.
But seeking out therapy that is culturally competent. And let me tell you a little bit about what cultural competency is. So there's what I've learned is that there's 4 C's in regards to cultural competency. First is like having curiosity, right? Finding a therapist that is curious about where you sit and what race is like for you, right? What is it like being a black person in Wilmington, North Carolina, that's light skinned and it's 40 years old or whatever, right? So somebody that's really curious, right? And then finding someone that also allows you to feel comfortable, and to be able to have your individuation and to think for yourself.
Yeah.
Right. There's people in my family that I wouldn't feel comfortable talking about certain things with myself in politics, right? Because it's just like, it's not safe, right?
Yeah.
And that comes from being non-judgmental, right? And the third C is being clear and having clarity on what it is, how they plan on communicating about race to you, what their understanding is of it. And lastly is confidence, having cultural competency comes from either having a lived experience, right, where you're looking into yourself, doing deep research, or seeking supervision. Right.
Gotcha.
So just backing up, curiosity, comfort, clarity, and confidence, and having a culturally competent therapist assist with working on some of those race-based issues.
That totally makes sense, because I mean, you wouldn't want to go to somebody that's like specializing in something that has nothing to do with you, and then they're telling you something wrong, and then you think there's something even more wrong of like the situation, the person, the place, the thing, and it just can create even more, confusion. That's the word, confusion.
Yeah.
Because you're conflicting with yourself, but you're conflicting with outside things, and that can be a big factor when it comes to therapy, is finding the perfect therapist for you. And not all therapists are going to be perfect. There's going to be some things that are, doesn't sit right, because we're human beings and you're human. I'm not a therapist. Let's backtrack.
Okay. Yeah.
Not all therapists are perfect, because therapists are human beings, such as you.
I was a human. I am a human. Yes.
You were a human being. But yeah, it's just important. And I think that that's really good advice, the 4 C's to keep into account when, trying to meet a therapist, and finding someone that best fits for you and your lived experiences. And
I also think if you're choosing to go and seek out therapy, it's important to have a conversation with your therapist and say, hey, I'd like for you to see how race has impacted me.
Yeah.
Right. And have the conversation like, you kind of missed it, and let them know what's working, what's not working. What I see also is that some individuals in the black community, they're not wanting to see a therapist that's not black. Right. And it's tough because there's not many black therapists, not many black male therapists in my area. So just having somebody that has that same lived type experience, it's tough. It's tough to even, when we're talking about stigma of even getting through the door, and then there's another wall that an individual has to go through. It's just like, it's discouraging at times. And I want to mention though too, an individual doesn't have to be the same race as you are in order to give you the help that you need. Yeah. Right.
Yeah, that makes sense.
And when in doubt, refer it out. Be like, hey, if you can't help me, then please help. Find me something that can.
Yeah.
Right.
You mentioned like a media detox.
Yes.
We live in a time right now where being online, social medias, our phones, the internet, like you can't escape it. Been there, done that. You can't escape it.
Okay.
And what is some advice that you can give to somebody that, say for example, when during COVID, we had the 2020 BML movement happening. And after that, we had more like conversations around it. And they're hard, heavy topics. What is some like advice that you can give to somebody that may be feeling that these topics are hard to digest? Like, what is some advice that you can give to those individuals?
Yeah, it is hard to digest. It is very, it's hard on a conscious individual that knows that people with that are part of your community are dying, and receiving unfair treatment, right? In your, like, very close by. So what I'd recommend is maybe taking that digital detox, finding things outside of the computer or outside of the internet to find happiness.
Yeah.
Right. Nature is really important. Exercise, having a game night with those friends. Right. Having FaceTime. I don't mean on the computer or with the phone, but like face to face with another human.
Yeah.
And also like working on activism. There's so many ways, the avenues in this town and in your local, or wherever you're listening right now, that you could work on helping out and assisting, right? And having that action behind those bad type feelings they're helpful. It's a sign of health.
Yeah.
Right.
That's good. That's really great advice. I think that's good for, honestly, not just people in the Black community, but anyone with everything that's been happening as of recently too. Just taking a step back from the media, it's a good, helpful thing sometimes. If you had one thing to take away about mental health within the Black community, and something that like you had to make not necessarily your slogan, but like what you live by, what would it be? It's okay to reach out and get some help sometimes. I want to reach out to the individuals that maybe are listening to this that are not Black, that are curious about Black mental health for whatever reason. I encourage you to continue to research the history and think about race. This is something that's important for Black community. It's a political thing to be Black, right? You wake up and you have to be Black, right? There's this example I've heard in college where there was two women. There were a Black woman and a white woman. They were looking in the mirror like, yeah, every woman's the same. This white woman's like, every woman's the same. And like, well, no, like when you look in the mirror, what do you see? I see a strong woman. Like, well, no, that's not what I see when I look in the mirror. I see a Black woman, right? And that, when we talk about privilege, right, having that, looking into some of the concerns in the Black community and thinking about your race and your privilege and how you might be able to use your privilege to help other individuals, right? I'm not saying like being a white savior or anything like that, but just increasing consciousness and seeing what's out there, I think is important. Yeah, for sure. Definitely. Always good to be educated, always good to be aware. Absolutely. And help in any way you can, give back in any way you can, even if it's just the smallest little thing, it can impact someone's life. Stay woke. Yeah. All right. Thank you so much, Cedric, for coming in today and speaking about mental health within the Black community. And if you guys want to listen for more, you can go check out our YouTube channel, In Between Sessions, here at Wilmington Mental Health.